Hello, I'm Kristina Cheek, and I'm the founding executive director of Sista Girl Birth Initiative. I am also a site coordinator for the Georgia Black Doula Network and a proud member of Southern Georgia Black Chambers. And I'm coming to you today to speak to you about some of the policy brief that I've been doing as a lobbyist and as a community birth worker with the Georgia State Capitol during this legislative session. Let's start off with House Bill 520, which is the Georgia Midwife Licensure Act. And basically what we're trying to do is expand the scope of midwifery and who can practice legally in Georgia. Currently, right now, certified nurse midwives can practice in the hospital and OBGYNs. What this does, though, is leaves a wide gap for women who want an out-of-hospital birth attended by a midwife. Right now, only a certified nurse midwife who has the oversight of an OBGYN can legally attend home births or birth center births in the state of Georgia. What this does is it leaves a lot of women without the care that they desire to have the birth attendant that they want at their birth, and it leaves a lot of room for possible criminalization for the women who are pursuing midwifery and practicing without being licensed in Georgia. There is a wide number of midwives, such as traditional, direct entry, licensed midwives who are practicing in Georgia, but basically what they're fighting for is for certification and legalization to be able to practice in Georgia. Also, we are looking at House Bill 441, which is the Personhood Act. And basically what this bill does is it establishes personhood at the embryo stage at fertilization. The reason why this bill is so controversial is because it designates at the moment of fertilization, as I said before, deems a person a human being. As women know, when we undergo our menstrual cycle and when we get pregnant, a lot of us do not find out that we are pregnant before 6 weeks. What that can do, if a woman loses a baby through miscarriage, or if for some reason, if she unfortunately suffers a stillbirth, she can possibly be criminalized because of the loss of her baby. This also, flipping my page, she can face possible murder charges. There is a lot of thought that in the hospital, if a woman comes in with a miscarriage, they are now investigating if she tried to give herself an abortion or the circumstances surrounding her miscarriage. A lot of us women who undergo miscarriages do not even know that we were pregnant at the time of miscarriage. So if she comes in and if she's seeking care after the loss of her baby, she will then be possibly criminally charged or prosecuted or flagged. This also targets her support system. This can look like OBGYNs who are trying to give life-saving care for an ectopic pregnancy, or if a woman is very, very, very high risk to where this pregnancy can put her life at danger. It goes after midwives, doulas, her family, anybody that supports this pregnant woman. It can possibly put them in a criminalize them if she loses a baby and it's deemed illegal or that she did something that was not legal. Also, as I said before, life-saving care such as a medical abortion or just a D&C where she may have some retained placental tissue that may turn into sepsis and possibly kill her, or helping a miscarriage fully come out of her system that can save her life. If the legal status on that is not clear, a lot of doctors have their hands tied and they are afraid to give her the care that could get her healthy again. Fertility treatments are also at risk as well. With in vitro and a lot of attempts at getting pregnancy, we know a lot of women do not automatically get pregnant. They go through a lot of losses following a positive pregnancy test. So if a woman has gone through a fertility treatment and she then miscarries, she then has to go through the process of going to her care provider and then possibly being prosecuted because of the loss of her baby. The other things that I'm lobbying for is for the PRAMS data and CDC maternal health outcomes data. It has been completely the access to this information has been completely denied. The Trump administration has made it where this information is not out there for public access. And this data tracks maternal infant health outcomes, maternal mortality, infant mortality. It tracks our breastfeeding rates. It tracks the different morbidities and things like that we need to be aware of in order to push for improved maternal health care and access and transparency and possible program funding. This is a complete breach and travesty because, again, censorship does not work very well, and this is going to be really bad for Black women, as well as the House Bill 441. We are also lobbying for doula reimbursement through Medicaid in Georgia. We want to see the Black perinatal health workforce expanded and being able to be adequately compensated for the work that they do. That looks like Black doulas, lactation providers, midwives, maternal mental health therapists, all of those women who practice in this profession. We want to be able to be adequately compensated through Medicaid, as the majority of our clients that we serve are Medicaid recipients. So we want to make sure that the women who have that kind of care are able to access these type of services that would normally, because of cost barriers, not be accessible to them. The other win that we did have through our lobbying efforts and advocacy was the community health workers certification with the Department of Public Health. It did pass, and now with the Department of Public Health, community health workers will have a standard certification process and be certified up to 2 years in the state of Georgia. So that is a win. We also are in the process of still trying to push House Bill 520. We did have a hearing on it. It is still in committee. It did not reach a vote. So we are going to try to pursue it again. That's probably going to go into the next legislative session. And right now, that's pretty much it. I am going to be doing a Black Maternal Health Week proclamation with the city of Valdosta and some other plans in the works, hopefully a maternal health coalition in the South Georgia area. So stay tuned for those. If you have any questions, please feel free to reach out to me anytime. Area code 229-474-9741. You can also visit me at Sista Girl Birth Initiative on Facebook. And if you see me around, please stop, pull me aside, and just ask about what we're doing at the Capitol. And I will be glad to share any information that is of your interest. Also, you can go on the website to blackmamasmatter.org. That is a wonderful resource for maternal health policy briefs and any kind of data that you would need to learn in more detail of what's happening and what needs to be done in the state of Georgia and nationwide regarding Black maternal health. Thank you for your time, and I'll see you later. Thank you.